Dr. David Borenstein, MD, discusses the future of regenerative medicine and personalized healing drive. David Borenstein has spent more than a decade watching patients walk into his office bent over from knee pain, unable to lift a coffee cup because of shoulder damage, or resigned to a life managed by prescription refills. Many leave with something different, a plan built around their own biology, not just their symptoms. It's a shift he has watched unfold slowly, one consultation at a time, over more than 10 years of practice. I started using stem cells over a decade ago when I was introduced to stem cells by the Cell Surgical Network, a California-based group that specializes in adipose-derived stem cells, Borenstein says. I started using adipose-derived cells and saw amazing results with patients with orthopedic conditions. That was over a decade ago. Dr. Borenstein was already a practicing physician and steeped in the traditional model of treat-the-symptom medicine. Then he saw what regenerative therapy could do for damaged joints and worn-down tissue, and he couldn't unsee it. That early exposure reshaped how Borenstein approaches medicine. He didn't abandon conventional medicine. He built something around it. Board certifications built over years of training. David Borenstein is the founder of Manhattan Integrative Medicine and now practices at Manhattan Integrative Medicine of South Florida in Boca Raton, where he sees patients as an integrative medicine specialist and functional medicine doctor. He earned his medical degree from the Technion Faculty of Medicine in Haifa, Israel, and completed his internship at Staten Island University Hospital. He is board certified in physical medicine and rehabilitation and certified in medical acupuncture, with additional board certifications through the American College for Advancement in Medicine and the American Academy of Anti-Aging Medicine. He is also a member of numerous professional medical societies, a resume built over years of formal training layered on top of clinical experience. He has been published in the European Journal of Ultrasound and served as chief investigator on a research project examining spinal cord injuries. That research background shows up in how he talks about regenerative medicine today, carefully, and without the hype that often surrounds the field. David Borenstein, MD, Manhattan Integrative Medicine of South Florida, didn't set out to build a practice around stem cells. After seeing how well its treatments worked, he brought that model into his own practice, built on a simple habit: listen first, treat second. David Borenstein, MD, says regenerative medicine targets the damage itself. Most orthopedic treatments chase pain. Borenstein said his approach chases the cause. Unlike other methods for treating orthopedic conditions that are symptom-based, stem cells and regenerative medicine can actually fix damaged tissue, he says. That distinction sits at the center of his practice. Patients commonly come in with knee osteoarthritis, shoulder pain, elbow pain, and neck and back pain, according to Borenstein. Rather than cycling through anti-inflammatories or injections aimed only at dulling discomfort, he evaluates whether regenerative therapy could address the underlying tissue damage driving the pain in the first place. For many of these patients, years of conventional treatment have offered only temporary relief, a cycle of flare-ups and follow-up visits without much change in the underlying joint or tissue. Getting to know his patients and understanding their symptoms, he says, are the starting points for every treatment protocol he designs. It's an approach that treats each patient's case as its own puzzle rather than a standard checklist. Every patient starts the same way, with a conversation. He takes a solid history, asking about frequency and intensity of pain, what makes it worse, what relieves it, and what treatments a patient has already tried. Only after that groundwork does a treatment plan take shape, one built around a specific person rather than a diagnosis code. That initial evaluation, he says, shapes everything that follows, from whether a patient is a fit for treatment to how the therapy itself is designed. He has described his greatest sense of accomplishment as coming from helping patients make real changes in their lives, especially after they've been through a difficult stretch of pain or illness. Dr. David Borenstein separates fact from fear around stem cells. David Borenstein, MD, reviews every patient on a case-by-case basis, and not everyone qualifies. Some patients have degeneration that is too severe or may have contraindications to stem cell treatment, he says, citing active malignancy, infections, and breastfeeding as examples of factors that could rule someone out. That screening process reflects a broader caution running through Borenstein's work. Regenerative medicine, in his framing, is a tool. A powerful one, but not a universal one. He said the goal is matching the right patient to the right therapy, and being honest when someone isn't a fit, even if that means recommending an alternative course of treatment instead. Misconceptions follow this field around like a shadow, and Dr. Borenstein has heard most of them by now. Some people think all stem cells are from embryos, even though the vast majority of regenerative procedures use adult cells, or mesenchymal stem cells, taken directly from your own body or derived from donated umbilical cord tissue, he says. There's also the assumption that stem cells are some kind of cure-all, a fix for whatever ails you, no questions asked. Dr. Borenstein pushes back on that one too. It can be effective, but never 100%, he says. And no, contrary to what some patients believe, it's not illegal or unavailable in the United States. It's regulated, it's practiced, and it's been part of his own clinical work for years. These confusions, Borenstein says, keep some patients from even asking the question, and it's part of why he spends time during consultations explaining the basics before any discussion of treatment begins. Getting the facts straight matters to him, maybe more than most doctors would bother to explain. He's not selling a miracle. He's offering an option, one with real potential and real limits, and he'd rather a patient walk in informed than hopeful for something that was never on the table. Linking stem cells to a larger functional medicine approach. For David Borenstein MD, stem cell therapy doesn't exist on its own. It fits inside a wider functional medicine philosophy that looks at gut health, nutrient deficiencies, and other root causes before symptoms even surface. Functional medicine focuses on identifying root causes, such as gut health and nutrient deficiencies, he says. Stem cells act as the body's natural repair system, releasing growth factors and signaling molecules to lower inflammation and regenerate damaged tissues. That framing treats the body as an interconnected system rather than a collection of isolated complaints. A knee injection means something different when it's paired with an evaluation of inflammation, nutrition, and overall metabolic health. It's a slower, more layered way of practicing medicine than writing a prescription and moving to the next room, and it's the model Manhattan Integrative Medicine of South Florida was built around. Acupuncture, anti-aging therapies, and other integrative treatments. Borenstein offers work alongside regenerative medicine rather than in place of it, each addressing a different piece of a patient's overall health picture. Looking toward the next decade of regenerative care, ask Borenstein where the field is headed, and he doesn't hedge much. These are exciting times to watch stem cell and regenerative medicine progress, he says. He points to induced pluripotent stem cells, or iPSCs, as the biggest leap on the horizon. By reprogramming adult cells into an embryonic-like state, researchers are working on personalized, off-the-shelf therapies aimed at conditions including type 1 diabetes, Parkinson's disease and macular degeneration, without the immune rejection risks tied to other approaches. The potential benefit is enormous, he says. It's a future built on the same idea that pulled Borenstein into the field more than 10 years ago, treating the body's actual damage instead of just its symptoms. He's watched that principle move from a niche approach used by a California network of physicians to something increasingly central in orthopedic and integrative care. David Borenstein, MD, Manhattan Integrative Medicine of South Florida, doesn't oversell where things stand today. He's quick to note limits, quick to name who shouldn't pursue treatment, quick to correct a misconception rather than let it stand. But when the conversation turns to what's coming next, decades of caution give way to something closer to enthusiasm. The future of stem cells and regenerative medicine is very promising, he says. The sky is the limit. For now, that future plays out one consultation at a time in Boca Raton, where patients still start with the same basic questions Borenstein has been asking for years. Science may be advancing toward reprogrammed cells and personalized therapies once considered science fiction, but the starting point at Manhattan Integrative Medicine hasn't changed much at all. It still begins with listening.